This slide shows us some of the key anatomical differences in the autonomic nervous system between the sympathetic and parasympathetic divisions. So one key difference is the site or the origin. The parasympathetic fibers begin in the cervical area, the cranial area, as well as the sacral area. So we call it the craniosacral division, whereas the sympathetic fibers begin in the thoracic and the lumbar region. So we refer to it as the thoracolumbar region. As I mentioned previously, the length of the fibers are a little different. The parasympathetic fibers has a long preganglionic, and sympathetic has short preganglionic. So if I go back just a couple slides to that one, we see this difference here. So the parasympathetic here, notice it has a long preganglionic neuron, and the sympathetic division has a short preganglionic neuron. The location of the ganglia is also different because of those lengths of the fibers. So since the sympathetic has a short preganglionic, it would make sense that the ganglia lie close to the spinal cord. Since the parasympathetic division has a long preganglionic axon, it would make sense that the ganglia are near their visceral effector organs. So this slide here kind of shows us some general differences that are mentioned on that last slide. So first of all, we can see the site or the origin for the parasympathetic. They originate in cranial fibers or sacral fibers. So some of those cranial fibers that you learned about in the peripheral nervous system are parasympathetic, especially the vagus nerve. Remember, 90% of the parasympathetic nervous system fibers are from the vagus nerve. The sympathetic originates from the thoracic and the lumbar spinal cord. The length of them are shown here. The preganglionic fibers for the parasympathetic are long. You can see the ganglia are represented here, and they're close to the effector organ. So you need to remember that the parasympathetic has a long preganglionic fiber, and the sympathetic division has a short one. The ganglia are close to the spinal cord. So that means that the postganglionic for parasympathetic are short, and they are long for the sympathetic. And then finally, this shows the location of the ganglia. They're close to the visceral effector organs. But for the sympathetic division, they're close to the spinal cord. So it's actually referred to as the sympathetic ganglia. And it literally forms a chain which is close to the spinal cord. So our next slide shows some comparisons here between the two. The rami communicantes row you can ignore. You're not responsible for that. But we have the origin here, craniosacral versus thoracolumbar. And some of the important cranial nerves are, remember, 3, 7, 9, and 10. The ganglia are terminal ganglia for parasympathetic and close to the vertebral column for sympathetic. And again, these are the lengths of the pre- and postganglionic axons. The degree of branching is not really important, but the functional role and the neurotransmitters are important. So its general function is rest and digest, whereas sympathetic is fight or flight. All pre- and postganglionic fibers are going to release ACH if they are parasympathetic. If they're preganglionic in the sympathetic division, they release ACH. But in the postganglionic, sweat glands are an exception. They release ACH. But the rest of them are going to release norepinephrine and epinephrine. So really just the tricky part is knowing that this is one of the exceptions, and that the postganglionic fibers for the sympathetic nervous system, they basically release what essentially is adrenaline, the epinephrine and the norepinephrine. And the parasympathetic division releases acetylcholine. So for the parasympathetic division, we know all this by now. It's the craniosacral terminal ganglia. So what is going to be important for you to know is the effects that happen at these effectors. So for example, what happens to the salivary glands for the parasympathetic division? And if you're thinking about digestion, it would make sense that you salivate when that happens. So all the digestive activities. These are going to be the parts of the cranial nerves for the parasympathetic division. So cranial nerve 3 is the oculomotor, and it causes the pupils to constrict and the lens to bulge. For the facial nerve, it stimulates the salivary glands, like the submandibular and sublingual salivary glands. Cranial nerve number 9 is the glossopharyngeal, which stimulates the parotid salivary glands. And then remember, the vagus nerve is going to account for 90% of the preganglionic parasympathetic fibers. These plexuses are not important, but the effects on the organs are. So, for example, the heart, the parasympathetic effect is that it slows the heart rate down. You don't need to know cardiac plexus. The pulmonary is going to affect these, and this is going to constrict the bronchioles. So that's the important physiological effect that you should know. For the esophageal plexus, again, the specific name of the plexus is not important, but it controls the stomach, liver, gallbladder, pancreas, small intestine, large intestine. And it stimulates all of those for digestion. For the sacral part of the parasympathetic division, it's going to originate from the sacral region from S2 to S4. You don't need to know pelvic splanchnic nerves. But again, what's important is to know what happens with these effector organs. And we're going to talk more about that a little later on. For the sympathetic division, remember it's also called the thoracolumbar division, and some structures are innervated only by sympathetic nerves, which would be the sweat glands, goosebump muscle, the erector pili muscle, hair follicle, and smooth muscles of blood vessels. So that's one of those exceptions, because normally the effector organs are stimulated by both divisions of the autonomic nervous system. This is showing the sympathetic trunk ganglia, and I want you to notice how close it is to the spinal cord. So again, that means that the preganglionic nerve, which is basically this part right here, the short part, is going to be very short compared to the postganglionic neuron. The opposite of the parasympathetic division. So this is our summary slide of the autonomic ganglia. So remember, terminal ganglia would be in the parasympathetic division. The sympathetic trunk ganglia would be the sympathetic. And if it's terminal ganglia, it means it's within the wall of the organ and besides the vertebral column if it's the sympathetic nervous system. And you don't need to know about the collateral ganglia. For the sympathetic division here, again, you should know the different functions for these. But again, we can see that there's a short preganglionic nerve and a long postganglionic nerve. So the ganglia is close to the spinal cord, whereas for the parasympathetic division, it's the opposite of that.